According to the CDC, the number of measles cases in the United States has already exceeded those of previous years. What's going on as people are refusing to get vaccinated, and is that part of the problem? Let's take a look at this report as reported by NBC's Kristen Dahlgren.
Tonight, a nation on alert. The CDC reporting 387 cases of measles through March, 15 more than in all of 2018. Making this the second most active year since measles was eliminated from the U.S. nearly 20 years ago.
1 in every 4 cases results in hospitalization, so it's a very serious disease, and it's readily preventable through vaccination.
According to the CDC, 6 outbreaks are currently ongoing in Washington State, California, and the New York metropolitan area, where officials in one county have tried to stop the spread by banning unvaccinated children in public spaces. Dr. Michelle Meyer is a pediatrician nearby.
We don't want to keep kids under lock and key, but we don't really know where they can come into contact with measles.
California now proposing legislation to give state health officials say over which children can skip vaccinations to counter what advocates call bogus exemptions. Communities on edge tonight as the disease, once eliminated, continues its spread.
Well, here to talk about this is a contagious disease expert. He is Dr. Amish Adalja. He is a board-certified infectious disease physician and senior scholar at the Johns Hopkins Center for Health and Security. Welcome back, sir. How are you?
Good. Thanks for having me.
All right. What do you attribute this new outbreak to measles, and how serious is it to the nation's health?
It's very serious because what we're seeing is record numbers of measles cases all over the United States. And the attribution is a little bit hard because there's a couple of different reasons why people are skipping vaccinations. It's not just all people who think that believe in the bogus autism MMR link. There are people who have...
And you do declare that that is bogus?
Yes, it's a debunked myth. Okay. There are lots of people who believe in vast conspiracies regarding vaccines, or that they're trying to get back to nature, or they underestimate the severity of measles, but all of this is kind of conglomerated together, and we've gotten explosive outbreaks in Washington State as well as now in Rockland County, New York, that are really threatening to put us back to an era when measles was much more common. And it's important to remember that measles hospitalizes about 1 in 5 children, and about 1 in 20 get pneumonia. This isn't a benign illness.
You mentioned New York State, where they are saying that anybody who has measles cannot be in a public space. Is that an overreach or an important preventative measure?
It's an important preventative measure, and it's mainly done to get people vaccinated. So we've got a high number of unvaccinated children in Rockland County. So what's happened is they've declared a state of emergency saying if you are not vaccinated against measles, you shouldn't be out in public because you are at risk for getting measles because it is so widespread in that county. And this is something that public health authorities have done before in the past. This is the first time we've seen it in the modern era, but it is part of their public health powers and their ability to protect people from contagious diseases. So I don't think it is an overreach. I don't think they're going to enforce it very strictly, but hopefully it will get people to get vaccinated and realize how serious this outbreak is before it gets worse.
Dr. Adalja, I have to tell you, I'm old enough to, when I was a kid, had mumps, measles, chickenpox, almost every childhood disease. That's what they considered it at the time. Do I have any special immunity because I've had all of those?
You should be protected because you've gotten your immune system was exposed to these viruses. You developed antibodies. So if you were exposed to these, most likely they wouldn't harm you. But in the modern era, we have got vaccines, so people don't have to go through the suffering of having measles or mumps or chickenpox. But it's interesting because people are kind of forgetting that these vaccines were invented for a reason, that it's not good to have children suffer through these diseases, and sometimes it's a little bit of Russian roulette. Some people get hospitalized, some people get very sick from these illnesses. So if you've got a very safe and effective vaccine, why not use it? It's an important tool, just like an iPhone. It's a technological solution to a problem
that didn't exist some time ago.
Right.
Okay. In Washington State, I understand the outbreak there was caused by a child who was admitted to the hospital for some emergency procedure, and the authorities didn't realize until a day or so later that she had measles, and they quarantined her. Is just contact with someone the possibility of spreading measles? And are adults affected by this now who haven't been vaccinated?
So measles is one of the most contagious infectious diseases that we know. So just being in the same room with somebody can get you infected with measles because it's airborne. You can be in an elevator, leave the elevator, and the people that get in the elevator next can get measles. So
wow.
It's it's very hard to stop an outbreak when you've got multiple exposures because of how contagious it is. Adults can get measles if they haven't been vaccinated or if they didn't have natural immunity. So there are adults, but in most of these outbreaks, we're seeing the bulk of cases happen in children, but there are adults that can get it if they've not developed immunity through vaccine or natural infection.
I understand you can die as a result of measles. Do you develop rubella fever or something like that?
So rubella is German measles, a little bit different, but from measles you can die. About 1 in 1,000 people die, and if you look worldwide, almost about 100,000 children die each year of measles. So this is a major infectious disease killer. It's not something that's always benign. We don't see that many deaths in the United States from our measles cases because we've got good care, but measles is a deadly infectious disease. And not only can you die, you can develop pneumonia, you can develop brain infection. It's something that is not some kind of childhood idyllic grandmother's tale. And I think that's one of the misnomers that we're trying to combat with these outbreaks.
At one point, measles had been declared eradicated here in the United States. How does it result in an outbreak again?
So measles was declared eliminated not just from the United States, but from both North and South America, the whole region of the Americas. But what that means is that we still get cases, but those cases originate elsewhere. So there are major measles outbreaks going on all over the world. So places like Israel, places like Italy, places like France all have measles outbreaks. There are actually travel advisories to go to these European countries because there's so much measles there. So what ends up happening is a traveler from here goes there and contracts it, or somebody comes from there to here, and they can start these outbreaks. So, for example, the Rockland County outbreak in New York State likely originated from Israel. So the fact that we've eliminated it doesn't mean we can stop vaccinating, because there are other places that can import these viruses to the United States. And it's also important to remember that Venezuela, which is part of the Americas, has a massive measles outbreak and has actually now removed that elimination status from the Americas because they've had an outbreak for over a year going on in Venezuela.
You talked about bogus objections to vaccinations, but what about religious objections?
I don't believe that there's any religion that actually says you can't be vaccinated. So most of the time people are using religion as sort of a crutch or an excuse not to be vaccinated. And I don't think that it's a valid reason to not be vaccinated, because you're kind of basically using a faith-based reason to not be vaccinated. And this goes back to the whole faith versus science type of debate, that there is scientific evidence that vaccines save lives, that they're safe, that they're effective, and that they are safe. There really should be no objection to it other than a science-based one, meaning you have a medical condition, you're on chemotherapy, you're too young to be vaccinated. Those are the people who should not be vaccinated. I don't think religion is a valid reason.
Dr. Amy Shadaja is our guest. He's an infectious disease expert. Our number here is 412-333-PCNC. Our conversation will continue with him in just a moment.
If you love everything about where you live except super slow internet, we've got good news. Introducing Viasat Fast for All Home Internet. With unlimited data, you can download or stream your favorite shows, movies, and sports on all your devices. Now everyone in your home or business can tap into super fast internet. Call Viasat today at 1-888-665-3296. Upgrade now to much faster internet. In fact, Viasat is 3 times faster than typical DSL. Get Viasat now and we'll guarantee your price for 2 full years. Everyone watching this commercial can now get super fast internet. Call now and get the perfect plan for you and your family. Plus, you get free standard installation that's fast and easy. Go to getviasat.com or call 1-888-665-3296 to sign up today, or visit your local Viasat retailer. Viasat, Fast for All, is here.
Have you or a loved one had an IVC filter implanted to prevent blood clots from reaching the lungs? You may be entitled to compensation. In May 2018, a jury awarded $1.2 million to a man whose inferior vena cava was perforated by an IVC filter, saying the device was defectively designed and manufactured. And in March 2018, a woman was awarded $3.6 million after her IVC blood filter broke inside her body, causing her to undergo open heart surgery to save her life. In an FDA warning letter, the manufacturer of the inferior vena cava IVC filter and its retrieval system was warned for failing to notify the FDA of life-threatening device malfunctions. The FDA specifically notes that the manufacturer misfiled consumer complaints, including a reported patient death, and developed the IVC retrieval device without FDA approval. How do you fight for the compensation you deserve? You choose the right legal team that has the experience, support staff, and resources to seek the most compensation for your injuries. Call now.
Infectious disease expert Dr. Amish Adaja is our guest. We're talking to him about measles, mumps, outbreaks of that kind of viruses and infectious diseases. I've read articles that say that in our southern border, over 2,000 people have been quarantined who are coming from these Central American countries, and others are saying that they have been exposed to diseases like mumps. Is this part of the reason for any of these outbreaks of these viral diseases?
No, it doesn't seem like the southern border is the actual source of any of these outbreaks. There is a mumps outbreak in some of those detention centers, but that's not something that's unexpected, and it's something that's very contained. The mumps outbreak that's going on the other side of the state at Temple, and there's cases now at the University of Pennsylvania, that's related to mumps cases that are circulating in the United States and the fact that vaccine immunity wears off, and when you're in these close-quartered environments in a college dorm, there's a lot of exposure to mumps, and it breaks through. I mean, we even had an outbreak a couple years ago with the Pittsburgh Penguins getting mumps and then going and visiting patients at Children's Hospital with the mumps. So this is something that happens. It has nothing to do with the southern border. This is something that's been going on for some time with mumps.
Well, are they taking effective steps to quarantine these 2,000 people there?
You don't need to quarantine for mumps. What you do is you tell people kind of to stay out of the public eye a little bit and not be out in public. But what you do
well,
is
if they're being detained, they're not out in public,
no,
right?
they're not. Yeah, they're not being detained. You just tell people to kind of voluntarily.
I mean, as immigrants, not because of the disease, they're being detained because they're coming here seeking asylum.
Right. So that's different. So what's going on at Temple is students with the mumps are being told, try and limit your exposure to the public, and they're vaccinating, again, giving people the third shot of the MMR vaccine, which has been shown in multiple outbreaks to be able to stop these things. But mumps is a pretty contagious disease, and I do expect cases will go up for some time until vaccination numbers go up. And this isn't really an anti-vaccine thing. This is just an effect that happens with immunity wearing off after the vaccine.
Well, speaking of infectious diseases, let's talk about flu. Even though we're approaching spring here, 12 people have died in Allegheny County, 2 recently from flu. Is it too late to get a flu vaccine, and how concerned should we be about flu?
Well, the peak of flu usually happens in February. It looks like we're going to have a longer season this year, so it's not going to necessarily end as abruptly as the start of spring. So we may still see cases for some time. So it's not too late to get a flu vaccine. I do expect the season will last a couple more weeks. The thing that happened here is we've had 2 different strains. The first part of the season was dominated by one strain of flu, and then a second strain kind of appeared later in the season, and that's what's led to this extension of the season. So it's kind of an interesting, each year the flu season is a little bit different, and this one is a little bit more interesting than usual, but I hopefully think it will actually start to taper off soon. But there probably is still some benefit to getting a flu vaccine this late.
And the planning for the flu, was the guest good enough to know what kind of strain would be out there, that this flu vaccine is effective?
Yes, the guess was pretty good. I think that they had good data when they made the flu vaccine for this past season, and we've seen a lot of protection levels that are much higher than what we usually expect. So we're kind of at the average of 50 to 60% protection from the flu with this year's vaccine, whereas the year before it was very dismal. So they did pretty good. They are updating the vaccine for next season, so it will be a little bit different next season based on what happened during this season, but it was a pretty good guess this time.
And who is most at risk, the very young and the very old?
The very young, the very old, pregnant women, people with comorbid conditions, so people who have diabetes, heart disease, kidney disease, lung disease, all of them, all of the immunosuppressed patients like transplant patients, cancer patients, organ transplant patients, those are at higher risk. But we try to get everybody above the age of 6 months vaccinated for flu.
That's everybody, so the whole population.
I mean, that's the goal, but there definitely are some groups that are much more at risk, such as pregnant women, that we really prioritize.
And one more time, could you debunk the myth of fear of vaccinations? I can't tell you how many calls I take about mercury in the vaccines, autism, and this sort of stuff, and a parent's right to say, I'm not going to have my child vaccinated because of their beliefs, as opposed to public health risk of spreading some sort of viral disease.
So each of these types of things that get asserted, mercury, autism, formaldehyde, there's so many of them. They have all been debunked. They've all been studied in multiple multinational studies that have shown that there is no increased risk of autism. The mercury that was in certain vaccines is not the type of mercury that is dangerous. There is a little trickiness that some of the anti-vaccine people did to try and confuse the public. All of that's been debunked. All of this has been studied. Think about how much research time has been wasted debunking these arbitrary assertions from the anti-vaccine crowd that could have been used to make new vaccines or better vaccines. So I think it's really been distracting. The issue with parents not having that right, that's fine. But we're not saying that these vaccines have to be a condition of being born. Then don't send your children to school. These are school entry requirements, and schools have a right to say, this is what our entry requirement is.
Stay out of the public spaces, if you believe that.
Right.
Okay. All right. Dr. Adaji, thank you as always. We appreciate your expertise, sir.
Thanks for having me.
Okay. I'm Chris Moore. Our program will continue in just a moment. I hope you'll stand by.
Severe weather